Hi everyone, welcome to this fortnightly Tools of Frontline staff session. We've got two people who are going to talk today. So we've got Eva, who's here from Hackney Caribbean Elderly Organisation, and then we're going to hear from Charlie from the council briefly to talk about the new Here to Help guide. So I'm going to pass it across to you, Eva, and thanks so much for coming along.
Hello, good afternoon, everybody. So I'm Eva, and I'm the advocate here at Hackney Caribbean Elderly Organisation. And I'm going to give you a quick overview of the organisation and the services we provide. So we are Hackney Caribbean Elderly Organisation, and we were founded in 1985. So it's actually our 40th anniversary. So happy birthday to us. We were born out of supporting Black elders within the community, but we've grown and developed into a totally inclusive organisation and make an offer to all those in the community who are over 55. On to slide 2, please. We are a community organisation dedicated to enriching the lives of elderly adults, and this you can see on this slide. Our mission statement is to bring together elderly people to share life. Our vision is to build strong and close inclusive communities who eagerly anticipate old age, and our values is a commitment to serve all who are 55 and over in an environment where everyone can participate, feel valued and thrive. On to the next slide, please. So we kind of activate our mission statement, our values and our vision through an offering a number of services. On a Monday, we are dedicated to supporting those who experience dementia through our dementia group. Attendance on this day is free of charge, and we do lots of exercises and offer support around dementia. And there's also free transport available, and it also provides like respite care for carers of those who experience dementia. On to the next slide, please. Our Wednesday group is mainly creative based around arts, crafts and discussions around art. Next slide, please. Our Tuesday and Thursday group is very exercise focused and games focused. Next slide, please. Each day, Monday through to Thursday, we offer freshly prepared lunches and snacks for an affordable price of £5 per day. Next slide, please. Above and beyond the services we offer here in the community centre, which is based in Stoke Newington, we have a number of trips that go out per year. I think the last one was to the Isle of Wight. Here is a picture of an event which took place at the Royal Albert Hall. Lots of seaside trips. We've also been to the theatre recently and been to a couple of art museums. Next slide, please. My job is specifically around advocacy. I'm the advocate here, and I also run the outreach project. So the aim of my role is to empower elders to deal with issues autonomously. So I speak up for them where they can't speak for themselves, but usually it's a very supportive role and an encouraging role. So I provide community advocacy as opposed to statutory advocacy, and here on this slide are examples of the type of work that I will do with someone who requires my help. So, there's lots of dial-a-ride applications, taxi card applications. Attendance and allowance is quite big, because that's, as you probably know, that's a pot of funds which the government holds as a benefit, which is available to those who are pension age and above and have an ongoing health and medical need. And it's one of those benefits which we try really hard to raise the profile of. So other services that I help the elders get: food bank vouchers. I help with referrals to housing and health and social care. I do a lot of form filling and quite a bit of signposting. I don't offer advice because that's not my remit or my speciality, because we're very community focused. I'm currently running an outreach session at Holly Street Lunch Club. That's another organisation which provides lunch to elderly members of the community, and I go there once a month. Most of the services that Hackney Caribbean provide are membership based, and I'll talk about that a little bit in a moment, but I'd just like to make clear that the advocacy and outreach project and the advocacy I provide is not exclusively for members. It's for all elders. So it's free. I try and run an appointment system. If we can move on to the next slide, please. So I was talking about kind of the membership aspect of Hackney Caribbean. So in all cases, apart from the advocacy, we have a membership policy. There'll be a referral form that we're getting, and it's completed. We'll schedule an assessment, and all being good, you get through that assessment. There's a membership fee of £15 per year, and for that you get all the services which I've outlined previously. We do ask that people can get here independently, but you could use dial-a-ride or taxi card, or have a family member friend to bring them here. Next slide, please. Oh, come to the end of the presentation. We are based at 39 Leswin Street in Stoke Newington, and those are just a couple of contact numbers. There's my email. The day services manager, Beryl Poozy, she deals with all the actual assessments for the membership, and we're open Monday to Thursday. I'd now welcome any questions you might have.
Thanks, Eva. That was great. Charlie, do you want to come in?
Hi, Eva. That was great to hear. I know that I've been past lunch clubs before, and I've seen that they do great work. I just had a question about what kind of issues tend to come up. So obviously you said housing, and in this space we tend to hear about all sorts of issues that residents are facing. What tend to be the main themes that come up for you? Is it housing principally, or is it kind of energy, or what comes up?
A lot of attendance allowance, a lot of people due to their health and their age requiring that extra financial support to get them through to make ends meet. We had a lot around the winter fuel payments and the changes there. There was a real push to assess for pension credit. So I would just use the kind of government calculator and just do that initial assessment, and then support people then to phone the pension credit hotline so they can make the applications themselves. So that's been there was a big push towards the end of last year. Lots of kind of adult social care in respect of occupational therapy, referrals and assessment of houses for adaptations to help people be able to live independently and move around more freely and safely around their properties. In terms of housing, we've got a little bit of had a little bit of homeless assistance, and that tends to go hand in hand with issues around immigration and status. But again, I don't advise on those. I will signpost them on to the relevant agencies. So I hope that gives you a flavour of what we do, what we come across.
It really does. And I was going to ask, so I work in the same team as John and Jenny, and we work with an organisation called Crew Energy to deliver energy advice in community settings. If you'd like, I could reach out and we could arrange for them to come down to a session that you run. And speak to your attendees about how to maximise their energy.
Yeah, that would be great.
Save some money on bills, but also reduce their overall energy consumption. So I'll drop you a line. But
that'd be really helpful. Thank you, Charles.
I'll do that. And that's open to anyone on the call as well. I'll stick my email in the chat if they want to reach out about that.
Thank you for that.
Nice one, thanks, Charlie. Maddie?
Hi Eva, thanks for the presentation. I've heard of you guys before, but I just wondered, particularly like with older people services, generally it's quite hard to get men involved. So I just wondered what your how it is in your organisation, what your experience is. Because that's just what I've previously known, I guess.
I'd say the ratio is, in terms of our membership, would be maybe two. I wouldn't say it's half and half, probably 2/3 female and 1/3 male, maybe, and maybe going towards the half and half. Yeah, but the male membership is great. It's great, yeah, and they fully participate and are engaged. In terms of the workforce, because we have quite a few young people volunteering as part of their courses. It's mainly female, and the staff here are mainly female. We have the odd male volunteer, but the staff ratio is mainly female. But the membership is certainly quite equal.
Okay, thank you.
Thanks, Maddie. Emily, I think you were next.
Yeah, just a quick one, Eva. Thank you for that. Really interesting. I've heard of your organisation for a long time as well, but didn't know much. How do people find out about it? And do you promote it in any way? Are you always looking for people, or are you at capacity?
In terms of the membership?
Yeah.
I think I would say that we're always open to assess people. Certain days are busier than others. So today's a Thursday, that's quite a busy day. Tuesdays are quite busy, but I mean, we're always open to, trying to keep it as inclusive as possible and open to assessment. And I think we'd make it quite clear if we didn't have capacity. In terms of advertising, well, we've got a website, and I think we're also on social media. But a lot of it is word of mouth. In terms of the general membership. But in terms of the advocacy and the outreach side of things, I've been tasked to raise awareness of the advocacy provisions that we provide. Because again, it's quite word of mouth, and I really do support our membership. And what I'd really like to do is to support more people outside of our membership. And hence why we've got the Holly Street outreach kind of session monthly, but I'd like to do a lot more of that. And it's in terms of, people can come here and make an appointment, come here. We've got a room we can use here for appointments. But it's for me to work out a strategy in terms of raising the profile of advocacy.
Thank you.
Thanks, Emily. Thanks, Eva. Abby, do you want to come in?
Yeah, thanks, Eva. I met Beryl a while back, but it's good to meet somebody else from the organization and hear about the great work. I had a couple questions. I'm going to try to prioritize so I don't dominate, but I do a lot of work with the same team that Jenny and John are on around advice, around food, around of support as well. And a lot of the advocacy work you're doing made me think about the advice system. So just one thing to share, and then another question to ask. But the sharing is around this campaign that's happening right now. It's an outbound outreach campaign that the council is working with policy and practice on around attendance allowance. Where there are 5 advice or organizations with trained advisors who can help people while they're applying for that to know, so they are trained in how to do that. If you want to, I can link up with you.
Yeah, that'd be really helpful. Yeah,
who those organizations are, so that you have people you can refer residents onto if they need additional support. And then speaking of that, I was just wondering, are there certain issues or organizations that you wish you were in contact with, that you don't yet have a relationship with, that we might be able, or someone on the team might even know, how to connect you into maybe finance and debt advice, for instance, or some of those more particular stickier areas.
Yeah, I think the more sticky areas for us, and there is a need for, is around the immigration, which is a very complicated area. And as I said, we don't advise on anything. We just signpost and kind of assist and support and encourage. I think immigration, because we have a list of agencies we can refer on to, etc. But as you all know, many are up to capacity, particularly like the Hackney Law Centre are up to capacity. I haven't been in contact with them recently, but previously they've been up to capacity, etc., etc. So it's that kind of thing, that more kind of complicated kind of legal side of things, to be able to have a access in to get timely signposting and referrals, and to know that you're making a referral and it will be seen and actioned quite swiftly.
Yeah, that is a challenge. Are you aware of the Welcome Hackney drop-ins?
Welcome Hackney drop-ins, no.
And Emily's on the line from Libraries, who can talk about that as well. So that's a great link. And maybe we should hear from Emily on that, and then Chris can go up after. I'll wait.
Yeah. So Hackney Libraries works with the refugee, migrant, asylum seeker team, the policy team, I believe. Are they, John and Jenny?
They're actually in adult social care, but we work very closely with them. So it's a new service, but it's a great piece of work.
I was never quite sure where they sit, but we at Dalston Library, it started as an experiment last summer and it's completely taken off. We dedicate the ground floor at Dalston Library every Thursday afternoon to welcoming people, refugees, asylum seekers, migrants who need signposting. They need help. We have what we've done is we've brought together lots of different services, like adult education are there to talk about ESOL classes. We've got a visa application thing set up in a separate room where people can go and actually get direct help with that. We have the library itself. We provide books in lots of different community languages. We try to get the right languages for the majority of the people that we speak to each week, and it's been a real success because there's a desperate need for it. But what's brilliant is it brings together all those different helpful services in one place at one time every single week without fail. It's on every, so people, again, word of mouth is how people have mostly found out about it, but it's
and that's helpful to know.
It's something that you could certainly send people to. There wouldn't be necessarily a lawyer there, but the people, there's so many different teams of people there who are all there to help and signpost.
Oh, that's helpful. I think
the status is, and there's, we did have scope disability energy vouchers and advice on Thursday afternoons, but we had to move that to a different slot because the queues were going around the block for that, and it was actually causing quite serious problems. So we've had to separate that out because there's a desperate need for that for disabled people who need, like, they could get energy vouchers, and it shows and lots of those people probably weren't quite eligible for them. It was difficult, but it shows the desperate need for help with energy costs. So please do let people know about that service. That's
really helpful. That's great to know. Thank you very much.
Emily, do you have some up-to-date comms materials that I could share with the newsletter about the Welcome Hub?
I don't. I don't directly work on it.
I think we put them in the team. I think we've got them. So we can put them in the newsletter.
We're reading, or
I think it was
next newsletter.
I think it was. They didn't come from libraries. They came from your side?
Charlie's put a link in the chat there. But you can also include a reminder in the newsletter. I think it's a useful, because it's an ongoing thing as well.
Exactly.
And we're definitely keeping it going. So
It's fantastic.
Brilliant. Chris, did you want to come in at this point?
Yeah, I was just going to say, Eva, I refer a lot of people to the welcome group in the library, and it is fantastic. It's particularly good for people who've just received their immigration status. They have to look for housing and all the other stuff and the benefits. It really is a one-stop shop.
Yeah, that's good to know.
Yeah, and in terms of legal advice, because when you describe what you do, Eva, it's almost identical to what I do. So I work within the HIV department at Homerton Hospital, and the really good news with HIV is that people are living very long lives with HIV today.
Absolutely.
Because the medication is so good. So I work with a lot of people over the age of 55. I actually have your leaflet here.
Oh, yeah.
But I'm a member of a housing and immigration group where you can post what you're looking for in terms of legal advice, and it goes to solicitors all over the country that will take on the case. And I find that is one of the most useful tools I have in my job. So I'm happy to request to add you to that.
Yeah, that would be really good. That'd be great.
If you post your email address here, Eva, then I'll get in touch with you separately.
Okay, that's great.
Thanks, Chris. That sounds really useful. I was going to ask a question as well, Eva. Have you guys had much experience in helping people make claims under the Windrush compensation scheme?
I think I've never done it myself, but my colleague Beryl has, and we've signposted to other organisations that have more experience and time to do that. Yeah, so we've done it. We've helped out on a couple.
I'm just a couple of years ago, I helped organise with some local advice partners some drop-in sessions for residents around getting advice and signposting for the scheme. And I was just wanting to speak to organisations who've got experience with making claims, just in case the council was to put on something similar again, and sort of what the best way of doing that would be.
Yeah, I mean,
if you're able to, if you're able to link me in with Beryl or whoever the right that'd be really helpful.
Yeah, I can do that.
Great, thanks, Eva. Jenny?
Yeah, the other thought I had, I don't know whether you're working with MRS at all, Eva, who work with, who do some similar, there's definitely crossover work and the same kind of demographic group. I know that they have, we've been working quite closely with them as part of one of our sort of funding streams, and we know that they have quite a lot of experience with some of that complexity around the immigration and housing and all the different intersections. They might be willing, Charlie's got a really good relationship with them, and could potentially put you in touch if it was another useful relationship.
Or
help you navigate.
So what does MRS stand for?
So it stands for Mobile Repair Service, but there's a particular project side by side that does outreach in Gillett Square in Dalston, and they really wrap around support, particularly useful for those that might struggle to attend regular appointments and that have got quite a lot going on, and they've done some incredible work. They can't often attend this session because they're very outreach based, but they're really they're really interested in sharing learning and developing pathways of support. So I'm sure that Charlie can put you in touch if that's helpful.
That'd be great.
Yep, happy to do that. I'll follow up with another email.
Great, thank you. I must remember to put my email in the chat somewhere.
Thanks, Jenny. Does anyone else have any other questions for Eva before we move on? Jenny?
Sorry, I just had, because I know we've got some children's services colleagues on the call. I was curious about whether any of the older residents that you support might be special guardians or have caring responsibilities for children, whether there was any intersection there between the sort of services of support for families. And I guess I was just thinking about those that I know that special guardians, for example, can offer.
Yeah, not that I know of, because they tend to have grown up adult children, but they may have caring responsibilities for grand children, and that would come under the special guardianship, etc., etc. So possibly.
But yeah, we wouldn't always know about that, I guess.
Yeah, exactly.
Yeah, thanks.
Abby, did you want to come in?
Yeah, Eva, I just had a question around, you mentioned spreading the word around the drop-ins for the advocacy work that you're doing, and that is free and available to even non-members. And what are you seeing right now in terms of that split in the use? The people who are familiar and come to all the sessions that you run versus those who are maybe not a member dropping in and using the advocacy?
Well, predominantly it's member-led at the moment, the advocacy, and of course it's and that's what I'm really keen to raise the profile of the outreach projects. In terms of the Holly Street outreach project, that had quite a good take up initially, but there are other services in that building like Hackney Age UK, who offer something similar in terms of not only advocacy but advice work. So it ebbs and flows, to be honest, but I'd like it to kind of flow more, and that's one of my kind of missions.
Thanks, Abby. Pamela, did you want to come in?
Yeah, I was just interested in Jenny's question about SGOs in terms of actually what support is that there, because ultimately what happens when the SGO is granted, we normally just think, okay, we're supporting through the social care purse, and that's it. So we don't really look at other services that could potentially assist our SG carers. Maybe in a permanency service they might do, because obviously I don't work for the permanency service. But in terms of children's social care, so talk frontline, when we're dealing with SGO carers, even before the orders are granted, we normally would just say, okay, we're paying them from the council purse, but carers allowances, etc. So is there any services that could potentially assist us? And it would be good if we can tap into it and obviously direct our SG carers to it. So it was a good question. Thank you for that, Jenny.
Yeah, I think it's a really important opportunity actually for us, because we do work with the permanency service, or I think we have done, as a trusted referral partner who distribute some of the household support fund to the special guardians that are supported through the council. We certainly had that relationship because we did recognise just what a vulnerable group they are with those additional caring responsibilities and financial challenges. But I think, Pamela, maybe there is an opportunity to make sure that services like Eva's, that would certainly be relevant if they needed wider support around things that aren't to do with the children. We're not very good, are we, in children's services at catering for what the adult in the situation needs. And similarly, as Eva was saying, she wouldn't necessarily know if they had caring responsibilities for grandchildren. But if through this connection we can make sure that the permanency service have the details for this advocacy service and any others that we know about that are currently taking referrals or those support services, maybe that's an opportunity for us that we can pick up as a team quite easily because of the referral relationship.
Yeah, I'm just mindful that the permanency service isn't here.
No, of course. Yeah, no, I mean, it's something we can have a conversation about, obviously, and I think it would be good for us to reach out to them and just make sure that they know about this session and the information that's out there that might be useful to share with them, because I think there is an opportunity in that financial assessment, isn't there, to then share wider supports that might help them, and particularly when they're managing the care of a child who's also experienced a lot.
That's really helpful. Thank you, Jenny.
Yeah, thanks, Pamela.
Thanks, Pamela. Thanks, Jenny. Does anyone else have any other questions for Eva, or anything else they want to raise that feels relevant to this discussion at this point? No? Okay, well, thanks so much for coming along, Eva. That was a really great presentation and great questions and great discussion. So yeah, come back at any time, and I will include your slides and any other info you want me to share in the newsletter as well.
All right, thanks for having me.
Nice one, thanks, Eva. I'm now going to pass across to Charlie, who is going to talk about the Here to Help guide that the council's put together around cost of living and other needs. Thanks, Charlie.
Cheers, John. I just wanted to flag before I get into that. In the chat, Batch has put a suggestion of another organisation she'd like to come and present here. If that's true for any of your organisations or anyone you can think of that you think you'd love to hear from, please let us know and we'll try and reach out and make those links. Batch suggested Rethink, which I think is a mental health organisation. So yeah, do let us know. So I'm going to talk about the Here to Help guide, which you might have seen across in different places in Hackney over the years. It's had various editions, and you should have received a version in your council tax. If you're a Hackney resident, you should have received a slim version in your council tax letter this year. Essentially, what it is, it's a guide the council has compiled of support that's out there for Hackney residents. And we know that we've heard that it's been very useful for voluntary sector organisations, because we hear that paper is king. You know, you can pass someone a leaflet, you can circle where to go, and we've heard that that's a really valuable resource. Obviously, if that's not the case, please let us know, but that's what we're working off. So we've produced a more detailed version for professionals, because the version that went out in the council tax booklet, we can't basically afford to print at that level of detail for every resident, and it wouldn't be appropriate for every resident. Not every resident needs to hear about every single thing going on in the borough. Not that this booklet contains everything going on in the borough either. So I just wanted to put this opportunity to flag it. There's a link to the PDF in the chat that I just put in, and I'll share my screen so you can have a flick. I'll show you what it looks like on paper. Sorry, I've got too many tabs open. It's taking me a little while to find. Let me close all my tabs, because otherwise I'm really struggling there. But I'll chat while I'm doing that. So we basically found that with the booklet, we went out to organisations and asked them to update us what was going on and what was going on in the borough. And the problem is with doing that is everything gets out of date really quickly. And we know that we've tried as hard as we can to make sure all the information in this booklet is correct, but we know that parts of it probably aren't, and things move very quickly because we're very blessed to have a very active and vibrant sector in Hackney. So I guess, as well as offering to give physical copies of this booklet, thank you, John. You're kind of more coordinated than I am there. This is what the booklet looks like. We also kind of have an option, so we have physical copies. If you'd like to get some of these physical copies, let us know and we can work out how to get them to you. Either you can pick them up from us at the town hall, or we are trying to work out how we can deliver them, but it's a bit of a complicated problem, that one. But do let us know if you'd like copies. Just email us or let anyone on the team know. But we'd also like to say, we think this booklet could be done in a different way. And if you'd be interested in helping us design the guide for 2026 or later in the autumn, we're really at an early stage here. But if you want to help us change the direction, have a sense of what's included, that'd be really helpful. Like, for example, we know that the intersection between poverty and those families with children with disabilities and learning difficulties is really high. So we've included lots of information about how to support children with learning difficulties in the booklet, because we think that intersection happens. So it's those kind of things that we're really keen. I think, Evie, you might well see your own lunch club in there, because we know that we've included the lunch club information. There's lots in here, but that's what we kind of wanted to share with you. And I'll stop talking because I feel like I'm rambling. But that's the guide. The questions are: do you want a copy? Let us know. The links in the chat, and would you want to be involved in how we can change it? Because we recognise there are things that can change.
Thanks, Charlie. Yeah, if anyone has any ideas, or that maybe once you've got a copy, you can sort of have a flick through and then let us know if you've got any ideas for how it might be improved next time. And yeah, if you want to get involved in that piece of work, then that would be great. And yeah, just let us know. Email Charlie or myself or anyone else in the team. Does anyone want to come in at this point, or should we move on?
Just while I'm talking, I know that I plugged Crew before as we were talking, but just to say again, that is an offer that's open to anyone in the borough. At the moment, we're working 4 days a week. That's Tuesday to Friday, and getting those sessions all over. If you would like us to attend, just reach out and we'll try and find that opportunity. I think they've come down to the welcome before, Emily. I don't know who else is on the call, but they've tried a few. They've been to a few places, and most of our feedback is quite positive.
Thanks, Charlie. Emily.
Yeah, just having a very quick look at it. It's very wordy. There's a lot of words. It's going to be very, very there's some horrific statistic about illiteracy levels. I think 60% of the population or something have a reading age of under 10. I don't know what the answer is. I'm just flagging it as something that looks densely wordy at just first glance. I haven't read it properly, but I do a lot on accessible language. It's just something that I end up having to do in a lot of, well, I've done it in a lot of my different roles. So I think that's something to think about. It needs to be incredibly easy to understand, and how you get across all that information, I don't know, but I'd be very happy to contribute if I can.
Brilliant. With your expertise, it is so challenging, isn't it? But we have found sometimes from this session that some people who've come regularly have used the newsletter to just pull out the bits that are most relevant to their groups, either on WhatsApp or sometimes to local schools. Wanted to make sure that the school staff or people that they know in the community have the bits that are most useful in the language and the formats that work best for them. So that's another thing to be thinking about, isn't it? Is kind of how we can how it can be used in multiple ways that work. Oh, Claire's go for it, Claire.
Yeah, I think this book is pretty good actually. The last time was really heavy on words. This is a nice, well, for us, we've been using it actually. It's been really helpful. It's much better than the last version. So we're one of the people that was always taking parts of it and rewording it for the people we are working with. But this is much better. And again, we always go through it with people depending on what they want. So it's easier when you've got the time to do that, to with people explain what in it, what they can get access to and how to. Just giving it to someone, maybe it's not as easy.
Thanks, Claire and Emily. Eva.
Yeah, I just think it's a big win that it's on paper, first and foremost. I support a cohort who struggles with online and technology per se. So I think it's a big win that it is on paper and it can be handed out and it can be circled and highlighted, etc. And I wish there was more of that, although I love the trees as well. So it's a balancing act. Yeah, so I'd be interested to be involved in it. It looks quite wordy, but then there's a lot of information in it. So I think it's about pinpointing what information you need. And I'd rather it all be in one place than in separate places. So I'm a fan already.
And that's good to hear, and that it's reassuring because we do hear that paper thing quite a lot, and and obviously there's a pressure to try and make things digitized, and because there are lots of efficiencies there, but we do try and push back and say our feedback is that paper is really useful when you're working with people. So I'm glad that's been validated. I'll reach out to everyone there about kind of how we do this going forward.
Yeah, sounds good. And if you want me to put a sort of pitch into the newsletter, if that's helpful, I can do that as well. Cool. Thanks, everyone. Jenny, shall I pass over to you to look at our ways of working?
Yeah, well, first of all, I want to go back to those that were new on the call that I had a chance to speak to. I think Emily spoke a bit about the Welcome Hub, but it'd be great to hear a bit more about libraries. And Chris is joining us as well from the Homerton for the first time. And we've got colleagues in children's services and a few others that I don't recognise. So it'd be lovely to, if anyone wants to talk, briefly about what you offer as a service, ask any questions to the group, so we get to know what your pressing needs are and how we can sort of support you as a group with those, then yeah, please come in. Chris, do you want to start?
Yeah. Hi everyone. So my name's Chris Buckley. I work at the Homerton in the HIV department. As I mentioned before, there's lots of good news with HIV, and there is effective treatment, which means people are living long, healthy lives. But that does require taking medication every day. And that's not easy when you don't have a roof over your head, or you are suffering from destitution, poverty. All these things make it very difficult to manage your treatment. So that's really why I'm employed at the Homerton. So I'm not a medic. I advocate for people. I do a lot of housing. I'd say probably 70% of what I do is housing. Also a lot of immigration. And I have one of my colleagues here, Janine, who is a peer navigator, a bit like a social prescriber, but specifically within the HIV department. There is a lot of stigma still related to HIV, and there are people who, if we send them to external agencies, they're afraid to go because of their HIV. And so that's why we're based within the clinic, and we aim to empower people to be able to access such advocacy. In a nutshell, that's what we do.
Amazing work, and I'm so happy you found your way to this session, because that's
actually one of our consultants recommended it to me, and I think maybe she's part of the wider Hackney network.
Yes.
And I've been meaning to come for a while, but Thursdays are a busy day for me. But I've prioritized today, and it's great to meet everyone and hear what's going on as well.
Yeah, we really appreciate it. And this does go out, the recording of this meeting goes out to a much wider audience. So if there are things that you're, wanting to let people know about, or services, or even ask about, I think last time we had somebody from lunch clubs on the call, just informally, like you were, who had a call out, and then somebody who wasn't even in the meeting contacted them, and they're now collaborating on something. So it does, it really pays to sort of let people know what you're needing, and what those that you're working with are needing. There are also colleagues, health colleagues on the call. We've struggled to get as many health practitioners into this space as we would really like. And I think I mentioned in the chat that we did have some feedback that it looks a bit too green and a bit too council, the newsletter, and sometimes that puts off our health colleagues. So we are looking at a bit of a rebrand, and we work a lot with health partners in the practical work of trying to sort of improve what we're doing to reach those that don't trust services. But we do have some colleagues. I don't know if you know Ngozi, who's on the call.
I do know Ngozi.
Oh,
yes.
good. I'm glad you've definitely got the right relationship there then, haven't you? And Eva, you've met, who does similar work. But we've also got Titilayo, I saw joined the call late, who's been coming here quite regularly from the long COVID.
I know her very well.
Very well. Very similar.
Yesterday.
Right. Oh, because it's those similar complex, not just health, kind of wider holistic stuff, isn't it? That's quite hard within health. So I'm really glad that you're already talking that you're already working with those people, and that you're here. In this session. Sorry, I'll lead over to Charlie.
Sorry, Chris, it was just a question. As you were talking about your work, a previous presenter was wanting to understand what the offer for those experiencing HIV more was in the borough. Are you familiar with the organisation Queertopia?
I am. I actually did a little presentation for them on Monday.
Okay, so I'm glad that's connected.
So yes, I am. Yeah.
Perfect. I just wanted to make sure that link was there. Glad it already is.
Brilliant. And while we're here, Chris, what would you and your colleagues find most helpful from this session? Bearing in mind, we are always trying to look for the right sort of, trying to everywhere we go, we're sort of inviting people to come and present on what they do, because we're always so inspired by what we're hearing, that we don't always know about within the within the wider system. So are there organisations that are there particular gaps that you really could do with knowing about organisations that might support a particular thing, or
very necessary for a lot of our clients? So we have a lot of clients with poverty issues, and they always need food bank vouchers. They need, energy vouchers if they still exist. We have issues around homelessness, and so any help, with extra places to shelters and these kind of things. I think also another thing that affects many people living with HIV is isolation, and I loved the Hackney Elderly or the Caribbean Elderly Organisation, the stuff around isolation and bringing people together. I think that's and we also work with more and more people living with dementia as well. And so to see the dementia group on the Monday, I've already got in mind now a few patients that I'm going to send along to that. So yeah, things that are bringing the community together are also really interesting to us.
Brilliant. Yeah, Claire, did you have your hand up there? Because Claire knows about a lot of stuff that's going on out there as well, don't you? You should probably tap Claire's.
Yeah, I mean, you should definitely get in contact, Chris, because we have so much stuff and we cover so much isolation in all the GP surgeries. So we're Together Better, and we're in like 20 GP surgeries. So we have loads of free activities, classes, workshops, and we could definitely maybe work together to create something in the right space for people that want to do something. So yeah, that's what we do.
Brilliant. Sorry, Claire, which organisation are you in?
So I'm Volunteer Centre Hackney, and the programme is Together Better.
Together Better.
Yeah, do you want to just say briefly what it is, Claire, because people might not know about it, and it's a brilliant...
Yeah, so we run a volunteer programme in GP surgeries, and we're funded by the NHS to support patients with low level, but all levels of mental health, isolation, loneliness, bringing them together and encourage them to deliver stuff that they would be interested in their GP surgeries where they feel safe. So we have 110 activities happening a week in City and Hackney that's free for everybody in 20 GP surgeries. So there's loads to choose from. They're all delivered by volunteers. They're all in a GP surgery, and it's from like social clubs to physical activities to art, all different types of activities. It really depends on what the people want. So any patients and what they want to do, we will help them and make it happen.
Brilliant.
Yeah, maybe we should put a reminder in the newsletter, Claire, if you're open to... Is it something that we can include in the newsletter again? Because I think, yeah, again, it's something that people may not be aware of and that lots of people might want to take advantage of. Even, parents, because again, like we were talking earlier about those working in children's services don't always know what's out there for adults. So if they know that there's those opportunities through GPs.
Yeah, because we don't have much services with people with children. And it's not through choice. It's just because the people that seem to be engaged with us are 40 plus, usually, not parents. And maybe it's the times we work, but we are kind of 9 till 5 because it's time for surgeries. But we're honestly there to help anyone make a change that benefits their health and well-being within their area, in their community. So we don't have kind of limitations. The only thing is they have to be registered at a GP surgery any GP surgery in City in Hackney.
Brilliant. Charlie, do you want to come in?
Sorry to put you on the spot, Claire. I wondered if you could speak about, or I know it might be Toyne's project, the work that you're doing with Saul at the Corporation Town. Is that work? Because I know that they did an event the other day, or was it the 4th of March? But I know it's not your project, it's Toyne's, so it might not be something you've got to hand.
Yeah, so obviously we have been... hello?
Oh, your Wi-Fi is going a bit funny. Yeah, carry on, Claire. We can hear mostly.
Okay, so yeah, we definitely have met with Corporation Town, and we've got a group of residents in the Wells Street area that are starting a food co-op. This was, again, because of cost of living. We know what's going on. We've always had a food pantry at our place. I'm the program manager for that as well. So we've always had a food pantry or some sort of a food provision for the community there. And the last one went to their new home, which was a permanent space, because we're never permanent. So we definitely got together with a group of local residents that was interested in starting a new one, and I've been working with Sol to start a co-op. So that's going pretty well. We've got 20 families now that want to be part of this co-op. So that should be rolling out hopefully within the next couple of weeks. Yeah. Sorry, my cat's going a bit crazy.
That's great. Yeah. Did anyone else have any reflections when Chris and Claire were talking about either of the areas of work, or any questions or reflections or anything you want to share there?
Lots of crossovers with libraries.
Yes.
We do an awful lot as well for everyone, really, all ages. My job title has lifelong learning as one of it's a long-winded job title, but lifelong learning is part of it. But that it's not just learning, it's engagement. It's much wider than learning. It's learning in all forms, mostly informal, but we do an awful lot for reducing isolation, for adults, for families, for children, for young people. And I think what I started saying at the beginning when I first joined the call about how we're positioning ourselves in libraries. Shall I carry on and do my bit? Is that all right?
Please do. Yeah, absolutely.
Because it does really link to what both Chris and Claire were talking about.
Yeah, thanks.
We've always been a frontline service for everybody, whoever you are. You don't have to be a library member to use our libraries. We have lots of people come in and just sit to keep warm, but we actively do things in the winter, like we have a coat exchange program where people can bring coats, and anyone who needs a coat can just come and get one. You don't have to ask for it or apply for it. We have coffee mornings at some of our libraries. So we do specific stuff, but we're there all year round, all across the borough. We're in every neighbourhood, just about. We've got one library closed for refurbishment at the moment in Stoke Newington, but that's arguably the least needy area. But yeah, we're spread across the whole borough, and we're trusted, a bit like Claire was saying about GP surgeries. We're a trusted space, and we're open late. We have study space, and we're packed at this time of year with young people who don't have space or computers or Wi-Fi at home to do their study. We do knitting, we do crafts for adults, we do games clubs. We're now doing exercise at Homerton Library. We've got hip hop dance for older people, which your crew might be interested in, Eva. Really fantastic hip hop dancing. It's wonderful. It's older women dancing with walking sticks and walking frames and just getting on down and having a brilliant time. But we are also we're also a frontline advisory. We can't give advice, but we often have people come to us when they need something, and the more information we can give our frontline staff for signposting, the better. And that's something that I think it's really good to be in this call and meet other people, meet you all, because I think there's lots of cross-referencing and referral stuff that signposting that we could all do more of, which is where the directory would be absolutely brilliant for our staff. I think it'd be slightly less useful to just have piles of them in the library for people to take, maybe, but to have them at the desks so the library staff can look up things that people are asking about, would be really good. I don't know what else to say really, apart from, yeah, we've got the refugee hub. We're thinking about doing we know that a lot of our users are homeless, experiencing homelessness. We know that some of them just use our toilets and our seats. We try and engage those who are just coming in for those things, but we don't always, but we don't judge anybody. We only ban people if they're causing major problems. So we've got a few banned customers, but not many.
Can I ask, Emily, how does it work if you're working with, because we get a lot of people on this call are working with people who are reluctant to go to services that you might signpost to sometimes because of lack of trust for lots of good reasons. You know, we often find, those that have experienced former discrimination, experiences of racism in systems, and even though, you know, it might be a trusted space for lots, but some people might be intimidated to go to a library or a children's centre or a GP surgery or to council building. How would you sort of encourage, are there ways of doing a sort of warm handover? Like if you were working with somebody who was a bit reluctant, but who, it sounds like you give such a warm welcome to people who might need a bit of TLC, that like, how can we help develop those relationships between the library? Because I think there's probably lots of services that don't necessarily know what it would be like for a resident they're working with to just sort of send them to the library. Who do they speak to? What do they, you know, how are they received? How would they know what to?
I think that's a really good question, and maybe something that I can't answer right now, but I think it's a good thing for us to think about, because we see ourselves as being so open for everyone, but from an external point of view, I can see what you're saying, that some people would even find walking into a library intimidating. I mean, especially people with literacy issues. Actually, it's a room full of books, which might be frightening for some people, and that isn't all we do. I haven't even mentioned books until just now, but they are like still the backbone, and lifelong learning being another backbone, that people can find things out and empower themselves and all of that stuff. I think that's something, I mean, I think we do it through things like the Refugee Welcome Hub. We do it through our coffee mornings. People might just come in for a coffee, and that's as far as they go. For a free coffee, people might come in who wouldn't otherwise. I don't know. I think that's something for me to take back to my colleagues. And
it's a huge challenge. I think it's something that we've been sort of grappling with since the pandemic in our work across the system with frontline teams around how do you, I think there was at one point where we worked on a tool called Better Conversations, where you could make referrals, and you may remember libraries probably had some training on it, but what we found from it was using the Find Support Services information. So it was like a directory that you could refer to. But what was interesting is people tended only to refer to the services they already had a trusted relationship with. So the referrals, when we looked at the data, people made referrals to the organisations they already knew and trusted and were used to working with, but they didn't refer to all the other ones there until they had a direct relationship with them, which was one of the reasons we set this session up, because we thought actually there's such a powerful, by meeting you, Emily, and you know, it brings to life how it might be going in a library, whereas you might just think that there might be just somebody there going, no, what do you want, books or this, or you might not know what it would be like or how you'd be received. By building those persons. So some of the things we've done is kind of visiting, you know, encouraging people to sort of visit each other's services and build those relationships outside of this space that can help you if you were working with somebody really, I don't know if Eva was working with somebody really who was really going to struggle to get there, what could help encourage that person? Could it be a visit with that person, or could it be, you know, a reciprocal, or could it be that the professionals visit one another to be able to understand what you can do, you know, because I think it really has made such a difference. I think these sessions in some of those kind of frontline practitioners feeling like you know, that I'm going to be able, that person's not going to be re-traumatized by being sent over there, especially when there's lots of things going on in their lives and they might need 5 or 6 different services or appointments. Sometimes signposting can feel a bit difficult for people if they're being told go there, go there. Whereas they know what they're going to receive on the other end and that it's going to be something that's helpful and valuable to them. I think it really makes a difference. So we'd love to continue working with you on it, Emily. I'm talking with Emma Winch actually about some of the challenges, because I think the challenge of opening up the doors for the scope support for disabled adults is a good challenge, because people are coming out of the woodwork
Yeah.
you know, might not otherwise have got that support, but it's obviously puts a lot of pressure on libraries who are doing lots of things. So can we work together as a system to support, to make sure that those people get the other bits of support that they might need? Because I suppose what it feels like we say here quite often is that those that we're working with never come with just one thing, and often it's voluntary sector, health, council and other services that need to be involved. And so the more we can have better understanding of what works between us in a relationship, the easier it is for those residents. So we're not sending them off in a direction, isn't it? But so so glad that you've found us, Emily, and look forward to working with you more.
I can also provide stuff for the newsletter.
Brilliant.
John, if you want, like, I don't know what, I guess it's some of the fabulous free stuff that we have that anyone can turn up to. Would that be useful?
Yeah,
I think that sounds great.
Yeah, Chris
just send it my way.
Yeah, free stuff gets people through the door. It's been really, we did the that definitely proved to be true. I think we did some work on food poverty in schools, and that Abby was leading on with the Hackney Education, and that really was a huge success. I think it got more parents together in an event when there was a load of services, but also some crisis support payments. So that, but I think it was a really great initiative. But all of those initiatives, I think, since the pandemic, that kind of bring people together through the Household Support Fund, we've done similar sorts of, and children's centres have also found that to be true. If you've got something like with the Alexander Rose vouchers, if you can get people in the door for a voucher for fruit and veg, they might feel more comfortable in the children's centre, and then go to after they've been a few times for that, like you said, with the cup of coffee, Emily, they might get as far as the coffee, but it might take them 3 or 4 times of having that coffee to then take the next step. Yeah, did anyone else have any questions or suggestions or thoughts for Emily on any of this, or any feedback about what your services might find helpful from libraries, to anything you want to know more about? Sounds like we should have libraries come and do a proper presentation soon on all of this stuff as well, Emily.
Yeah, I'll talk to Emma about that. Yeah,
that would be great. And was there anyone else on the call that would like to introduce yourself and talk about what your service offers to residents, or any questions or asks? I know we've got Ngozi on the line who's working with lots of health services in the Homerton. I don't know if you wanted to come in, Ngozi.
Hello. Hi.
Hi. How are you doing?
I'm good. My camera is not working. Hi, Chris. Hi, Charles. Hi, Claire. Hi, John. Hi, Eva. Hi, my name is Ngozi. As you can see, I've been working with Homerton for like 6 months now. And you created role of a care coordinator for the anti-poverty pilot, helping people, like the clinicians, do referrals to me, and I meet them at Hackney, the service center, and be able to talk to them to get more of what they need and where they need help. And with the help of John and thanks, John, thanks, Clark, they're here to help. Some of them have returned the email to me that they were happy they received the £100 voucher, which they said went a long way to solve a bit of their problem. Not all of it, but at least it went a long way. I've got a nice email from one of the patients that said, "Oh, the £100 really helped," because they were looking for money to charge their electricity and the cold weather last 2 weeks. So the £100 did go a long way. Thank you. And we'll also help them with housing issues, like filling out the forms or speaking to one of the housing officers in Hackney to tell them, refer them, and which band they are in, and to bid. So one of the residents as well, who is also a mother of an autistic child, has been able to be moved from band D to band A, which is the highest band. So in like 2 weeks, she'll be able to be rehoused, and she's quite pleased. Yes, so that's what I do. The clinicians and the doctors don't have time to talk to the patient, but I do give them my time, talk to them, get more information of where they need help, and take it from there. and then keep the referrals coming, keep me busy.
Brilliant. I'm so glad it sounds like it's having such a brilliant impact. And I know that you're already linked in with lots of people in the team on all of it, so I won't ask you what you need because I know that yeah, I know you've got what you.
Thank you.
Thanks.
Yeah, that's what I do.
Brilliant work.
Tell us, I'm distributing the Here to Help leaflet as well. I'm doing it. Yeah.
Thank you, Ngozi.
Thank you.
And did any of my children's services colleagues on the call, Pamela? I know you were new on the call, and there was somebody else also from Children's Services, I think, who joined us. I wondered if you wanted to share any sort of reflections from the session or talk about how you work and how you support people in Hackney.
I'm not new to the call. I've been here for a while. I think, yeah. Normally, I attend. I think I've been attending for about 3 months now.
Oh goodness, I wasn't here. It's me who's new to you, Pamela. Sorry about that.
That's okay. No, it's a wonderful session. Obviously, I attend normally to just get to know what's in the service, what's around in Hackney, so then I could obviously tell my colleagues in the Child Protection Service, because most of the time we do our work, but don't really know what services are around, and it's really helpful. Hence why I asked about the SGO, because again, it's that what can we tap into to ultimately support our families that we're working with, and the children and young people, especially, and and the carers that we work with, and most of the time we don't actually know, so we only know the major services like Hackney, Young Hackney, where we're working with them consistently. And also we have a change of social work as well. So even social workers that do know the services, when people leave or new people, they don't actually tap into these services. As we're discussing about the library and stuff and what all the services are available there. New people don't always know, so hence my attendance is really to just say, okay, this will be a good service for us, and I can go back to my colleagues and say, there's this service, what do you think about this? And it'll be really helpful.
I'd love to follow up a conversation with you, Pamela, on how we can do more of that, because I as I said, I used to work in your role in children in need service, and one of the challenges was always when the safeguarding risk had reduced, and so the cases really should have been closed and the families should have been moved on to a sort of early. But if they'd said no to Young Hackney or the Children's Centre support, you didn't know who else you could hand them to, and you'd be really worried. So often you'd have these case closure days where the social workers were all saying, but I don't want to close the case because I'm really worried about how this little boy will do when he starts secondary school, or how mum will do when the second baby comes. But it shouldn't really stay in children's services. But if there was a better relationship with some of the community partners and the voluntary sector that might be working with families, there might be a more smooth transition when it came to step down, as well as a smoother transition if you needed more help from social workers.
You said it better than me, Jenny. That's exactly it. That actually we keep cases open because we don't really know the services open instead of the services that we work with consistently. So actually that's why. So I would love to actually tap into, getting to know all the services, when actually me and you also having a discussion. So I could ultimately know what's around, so I can pass it on to our colleagues as well.
Brilliant. No, I'll definitely get in touch with you on that, because I think it was
Great.
as well as everything we learned through the pandemic about what matters when we're trying to work together to support residents. My own experience of that disconnect in children's social care was one of the reasons why I felt it was so important to have sessions like this, because it's so hard to keep track of what's going on and to have those relationships. But essentially we're all trying to get the same outcome for residents, which is that they don't need us anymore.
Thank you so much. I appreciate that. Thank you.
Thanks so much.
I look forward to hearing from you, Jenny.
Brilliant. Thank you. Any other reflections? Or there's something I did want to share with you if there was time, but I also don't want to take away space that people might want to connect or learn more about each other before we finish. Did anybody else have any want to come in on anything that they're working on or share anything, or shall I move on? Nobody seems to anything. Oh, Charlie?
This is just a plug for any organisations in the borough. Lloyd's Bank Foundation are running a collaboration grant. So they're funding 80 grand over a year for 3 years potentially to fund groups of organisations to collaboratively change things in their local area. The council can't apply and we can't be on the application, but I'm kind of keeping a track of anyone who tells me they're interested so I can introduce them to each other. I'm just going to stick a link to the grant in the chat. If it's something that kind of you think sounds right up your street, let me know and I'll introduce you to everyone else who said they're up for it. Unfortunately, that's where the council's role has to end at that point, but we can be at least the introducer if anyone's interested.
Brilliant, thanks Charlie. So I'm going to share this visual because there's so many of you who I'd love to get feedback from on this call. We've got such a wealth of knowledge here. So this team have been working with frontline staff across the system, including lots of people on this call. Claire Farigi on the call was working for a different organisation at the time and was very much has informed a lot of this sort of ways of working. But we've been working in lots of ways with voluntary sector, council and health to try different ways of working that make things fairer for Hackney residents, and this is one of those things. And this here is a sort of visual note that we have put together based on reflecting on the learning from lots of different pieces of work that people on this call, many people on this call will have been involved with. So we see this as a shared resource rather than a council resource. We've done it in the colours of the equalities plan, the council's equalities plan, but essentially working to make things fairer for Hackney residents involves everyone. And we have learned an awful lot from the way that our community partners work, rooted in communities, as we've heard from Eva's presentation and all of the work in libraries, that actually when we work in different, I suppose taking risks and being collaborative and centering relationships are some of the ways that we found really have helped us to build better relationships around supporting Hackney residents. And I guess I wanted to just share this with you in the first instance to just see whether anyone wanted to share any reflections relating to their own work, either the way that they work with residents or the ways that you've learned it's helpful to work when you're working with partnerships, collaboration. And I suppose what we're aiming to do, and the reason I'm bringing it to this session first, before it's not finished, that QR code at the bottom doesn't work. We're still in the process of finishing these, but it has come from the learning from all of those that we've been working with. So it's not our ideas, it's really from lots of different pieces of work that our team have been working on with others across health and council and the voluntary sector. So we're thinking about rebranding this session, instead of being tools for frontline staff, as being fairer ways of working, and that being one of the ways that we could develop this into a bit of a network that supports these ways of working and that helps bring people together. So an example of, Charlie talking about that booklet, and suddenly there's a group of people who are willing to give their expertise to help us make it work for Hackney residents, because we've got the shared purpose of making things fairer for Hackney residents. I suppose that's an example of all these fairer ways of working. And Batia, you're always, every contribution you make in the chat, we're always taking in and going, right, what do we need to do differently? And that's why we come here each week to open up and say, what do you need from us and what more can we be doing, because you're the experts really. And then I guess these are some of the principles in how we work that we feel we've learned from frontline staff, but also we think we need to do more of at every level. So we're trying to share these resources really and say, are any of these useful and to your services? So for example, Ngozi in the Homerton, to talk about the work that you're doing there. The work that you're doing there is very much about fairer ways of working. So for these to be useful, we would want to know that they resonated with your work. So I have spoken for long enough, but I guess it's given you time to actually look at it. I hope it's big enough, but I would love to hear from anyone who wants to share anything on it or has any questions. Well, I'll be bringing this back each time we meet, because this is a space that we can kind of plan what we do next with it, really. Does anyone want to share any thoughts before I start picking on people?
I think it covers everything that I would say if I was writing it, actually. That's literally sounds like me talking on that leaflet.
That's what we were after, Claire, because it's it's the thing that you've been telling us since the pandemic that we've been, testing and learning from and doing more.
Yeah, it's literally, it makes sense. It's all about the people. It's about the way you communicate with them, the relationship you build with them, the trust, and that's how the word spreads. Some of the things are easier said than done, of course.
Yeah.
But visually might be a little bit confusing for people. It's like a magazine, and it was a bit.
It's a lot, isn't it? Yeah, we've got the individual assets, you see. So we've got everything that says, like, being human, like trust, move at the pace of trust, or relationships start with being human, or all of those. We've got as separate little visuals.
Yeah.
So we're trying to work out who might want to use them and how we could plug them in, and whether we need some principles around the use of them that are about our collective work and not about an individual service's needs or priorities, if you see what I mean. That it's a kind of sort of that they can be used.
I agree. I think it is it's a way of working. I do think that myself. There is obviously barriers depending on the role or what criteria it is, but it still is a way of working, and it's hard to build relationships if you have a role that makes you move around and spend less time face to face with people, frontline. But then it could be for managers to make sure they hold their team, because if they're building the relationships, really retaining good staff and keeping them so that you don't lose them, because that happens so often, is if when you have great staff, Charles, he's great, we love working with him, so just plug you there, Charles, well done. It's really hard to replace that with any role. So if someone leaves or promoted or anything, the relationships there, people build relationships with people, not services. Services are a benefit. So it's the relationship. You could have an amazing service, but your staff are rubbish, they don't engage with people really well, and people don't use it. So I think it's really good. It covers everything that you should be thinking about when you're trying to engage people into something that can benefit them.
Brilliant to hear. Charlie, thanks.
I just wanted to come in and say thank you, because all the feedback you gave us and our colleagues in housing services about when we've trialed different surgeries with Together Better, that's one fed into our thinking about how there are ways of working, how we establish those principles. But now the housing services are using that visual in their training of officers about how to engage with communities. So thank you for making the time and bearing with us through that journey, because it's that learning that we've been able to really kind of hopefully share with them and get them to start thinking about it properly. So thank you.
And that's, I guess, why it was the most important that we brought it back to this space first, because we don't want it to feel like it's like the council's come up with all these ideas and we're coming to the community and going, hey, this is all come from you. So all these years of us going, we want to learn from you and we want to understand what's needed has been, and then practicing some of these ways of working, like the housing surgeries, but also the council tax pilot that Jonathan Lang was involved with, who's on the call, and Krista, who I know you work with too. But I mean, the work with Shahid was early contribute. Everybody's contributions in this space have kind of helped us to sort of go, well, what are the things in common across all these pieces of work that are helping us here, and how do we, and we have got, in fact, we've been talking with libraries, Emily, about some of the work, the community power work in libraries that Alice in the Space Bank is working on, using some of these visuals as well, because I think Emma was interested in that. So we're sort of wondering whether these could be these could give us some coherence across all these different bits of work that have quite a lot in common. So I guess, Chris, like the way that you were talking about you work being quite similar to the way that Eva would work and Gozi would work, this is all relational work, isn't it, that we're talking about? And it is with residents who often have a lot going on and don't necessarily easily trust being told, right, or have a very easy one service solution to a problem. I think that's a lot of our services are sort of built for sort of one problem, and actually the reality of our work kind of puts us in touch with a lot, doesn't it? But yeah, did anyone else have any reflections or feedback on that? We will keep showing it to you and put stuff in the newsletter. Any other thoughts? Chris, you looked like you were going to say something.
Just to say, it's been a brilliant meeting. I've really enjoyed meeting everyone, and I really see the value of it. I'm going to request that John adds 2 of my colleagues as well. And just thank you, everyone. Really, really very helpful.
Great, that's an amazing place to finish. Thank you. And people stay past the time that they're actually supposed to be working, which is always, and people come early, so we're always delighted. It's been a brilliant session. It's been great to have so many experts on the call, and thank you all for bearing with us with it all. See you in a couple of weeks. John, did you want to quickly mention? Yeah, thank you. So good to meet some new people. Yeah, what's on next time in 2 weeks? Was it the Solihull?
Yeah, Daniel is going to be speaking. I think I'm just having a look at the forward plan. Yeah, it's just Daniel at the moment, but if anyone else wants to speak at the next meeting, just let me know.
And especially, I guess, anything to do with parenting, because there'll be other people on that one. Anything to do with support for families before Easter, that might be useful if you know of anything that we should be letting people know about. Great.
Thanks,
you
everyone.
much. See you soon.
Bye.
Nice to see you all.
Thanks. Bye.
Lovely evening.
Everyone, take care.
Thanks all.
Bye.
Nice to see you, Jenny. Bye-bye.
Bye.